spirit of Texas.
From WFAA-TV, the spirit of Texas. This is Good Morning Texas in high definition.
So earlier in the show, we showed you the right clothes to make a man look like $1 million, and your hair, it also makes a big difference too. Dr. Mark Bashara with the Paragon Plastic Surgery is joining us to talk about hair restoration using new technology, and I'm excited to hear about this because, let's face it, this is a big problem, especially with men. So we're happy to have you here.
Thank you. Thanks, Alana. Yes, you know, the ARTAS robot is one of our tools that we use. It has a dual camera system that actually takes a look at the donor area in the back of someone's head, and then we can actually analyze and look at the different distribution and the density and look at the direction of the hair follicles and actually dissect them out individually. So it's a pretty neat tool.
How is this transplant different than maybe some others that are out there in the industry?
Sure. Well, the conventional transplants of old, and what's been going on for about 30 years, is where people would take a strip of scalp out of the back and close that up with a linear scar. And so you would either use a suture or a stapling technique, and that would require some specific downtime, typically about 2 or sometimes even up to 3 weeks. Nowadays, with a follicular unit extraction technique where we are individually going through and taking out these grafts one at a time, we don't leave somebody with a linear scar, and that's very beneficial because their downtime is about 2 days of what we call physiologic downtime, and then about 7 days or so, almost a week of what's called social downtime. So that's just where they have some scabbing and where hair might need to grow back.
Oh, that's still better than 2 or 3 weeks.
Sure.
Much better. Okay,
sure.
Well, let's hear about the experience that the patients might go through when getting the procedure done.
Sure. So the day of the procedure, you know, it sort of starts off with a consult at some point before the day of the procedure, but when we look at them and we deem that they are a candidate for transplant, we'll bring them in typically around 5 o'clock in the morning. We sign some permission forms, we'll take some photographs, and we prep the scalp. Everyone in our practice who's going through a robotic hair restoration procedure is now using something called platelet-rich plasma. And so that's only being done in about 10% of hair transplants in North America. And so they will come in, we'll do a ring block around the areas that we're going to dissect out, place the patient into the robot, dissect out the grafts, then make the holes and transplant them.
Okay. Well, you know, earlier you mentioned it's about 2 days of downtime and 7 of social downtime.
That's correct.
And so if somebody was to get this done, how much time do you think that they should set aside just from beginning to end?
Well, I think, you know, if someone has sort of a long weekend, like a Thursday, Friday, Saturday, that's usually significant enough, or even a short week. So, you know, that's kind of the average time that we're recommending that people at least have. And, you know, it's always nice if you can parlay 2 weekends on either side of the week, but if not everybody has that luxury, and usually you don't need it anyway.
Okay, well, of course, one thing, and I'm sure many people who would be interested to have this done is curious to know, is this going to last me forever? Is this a permanent procedure?
Right. So, you know, hair loss, as you know, is a lifelong problem. This is something that you have to deal with if it bothers you until it doesn't bother you anymore. And so there are other measures that we can take that are more preventative in nature, but they don't necessarily treat the underlying baldness. So once you have bald scalp, shiny bald, non-hair-bearing scalp, that's a transplant, and that's the only definitive thing that we have to use to correct it.
And quickly, can you tell me, for men who might already have that bald spot, at what point should they come in to get this done? When it's already gone, or in the process, or they start to notice that it's starting to thin?
Right. Well, what we've sort of realized is that men between ages 20 and about 50 lose hair at an accelerated rate. Not to say when you hit 50 you're not going to lose any hair, but they lose it at a much faster rate. And so we want them to come in early, before the hair loss is apparent. And sometimes we can utilize preventative measures, or convert somebody from a much larger procedure into a smaller, more succinct, straightforward thing.
Doctor, really, really great information. This would be a fantastic Christmas gift if your husband may be starting to have a little bit of that bald spot. For more information, log on to artishair.com, or simply head over to markbasharamd.com to contact Dr. Bashara.
Thank you.
11